This headline from Entertainment Tonight really made my blood boil because it's completely untrue. Let's talk about the reasons why people get breast cancer and the relationship to IVF. No shade for Shannon Doherty. I think she said what she thought, even though it was medically inaccurate, and shame on some of these media outlets for running with it like it was fact. I literally do IVF on people who have active breast cancer, and it does not increase their overall morbidity or mortality. Please don't be scared of this headline because it's not true. First of all, IVF is where you're given drugs for about 10 days that increase your estrogen because they increase the number of eggs you're making. Anything in your life that increases estrogen long term, not for 10 days, but long term, can give you an increased risk of breast cancer. Progesterone is very protective. So people who have had pregnancies, the earlier the pregnancy, the better. People who have breastfed, these are things that are very protective against breast cancer. Now, people who have infertility are at risk for breast cancer because most of them have not had a baby. And Shannon Doherty has not had a baby. That gives her the highest risk of breast cancer, not the fertility treatment. So if you have infertility, it doesn't matter whether you do treatment with inseminations and pills or no treatment, you decide not to pursue family building, or whether you do IVF, you're at increased risk. So it wasn't the IVF that put her at increased risks, but the infertility. These headlines to me are very fear-mongering, and I think that they're very damaging to people who are in the middle of fertility treatment because they're not true. So I would recommend ask your personal doctor what your risks are. You can also go to this website. This is a website from the National Cancer Institute. It is the GALE, if you look up here, the GALE model of looking at breast cancer, and you enter in a bunch of information about yourself and it tells you your short-term and longer-term risks of breast cancer. This is also why you should have a yearly breast exam. And if you're 40 or over, you should be getting a mammogram, or earlier if you have a family history. These are reasons why you should get good preventative health care. So get accurate facts and don't just listen to entertaining, fear-mongering headlines.